Dr. Michelle Roley-Roberts. So as I said, you guys, we've been working with her. You've heard her input as a hub member, but just to tell you a little bit about Dr. Roley-Roberts, she's an assistant professor and a licensed clinical psychologist at Creighton University School of Medicine and associated with the Department of Psychiatry. She's got extensive training and treatment experience related to trauma and trauma-focused CBT. She also, you might be wondering, hey, so we've got a psychologist joining us from Nebraska. She's homegrown from Ohio, so she's got the great aspect of knowing the Ohio system. She was a postdoc at the Nice Hunger Center and grew up in Southeast Ohio. So I could spend a bunch of time talking about her, but I want to give her all of the time to tell you guys and share what she knows. So with that, Dr. Roley-Roberts, I'm going to let you go ahead and share your screen and take it away.
Thank you so much, and thanks everyone for being here. I'm super excited to have you and to be able to talk about my favorite topic, which is childhood trauma. Okay, can you give me a thumbs up if you can see my screen? Awesome, okay. So I'm gonna talk a little bit about trauma, and I have nothing to disclose, by the way. Just briefly before I jump in, I want to acknowledge the team at Nice Hunger Center and Cincinnati USAID, as well as Wyoming Institute for Disabilities. So here's my learning objectives. We're going to talk about this complex relationship between substance use disorders and traumatic stress or adverse childhood experiences. I'm going to define traumatic stress and identify potential ACEs that children could have related to the opioid epidemic. And then we'll talk about the importance of culture and cross-generational transmission of parenting practices and how that influences traumatic stress. And then I'm hoping that you'll leave with a skill today, or if you already have the skill, it's been even better because you got to practice. So I'm going to have some trauma-informed strategies for you to use with your children. And then we'll talk a little bit about emotion regulation. Okay, so just briefly, some background. So there's been a lot of research on adverse childhood experiences. So this is adults reporting about their experiences in childhood. And what we found is that having just one ACE or one adverse childhood experience increases your risk for a substance use disorder by 2 to 4-fold. And when we compared to people who had no ACEs at all, adults who had 5 or more ACEs were 7 to 10-fold more likely to have a problem with a substance use disorder. Now, we did an asynchronous training with early child care providers, and we asked them to report their knowledge of the children in their care having exposure to ACEs. And what they reported was that on average, the youth in their care had experienced 2.8 ACEs. So these are young children, so 0 to 5. And we've already, just based on this, we can extrapolate that these kids are already at risk for substance use disorder in adulthood. So the takeaway here is that early child care workforce, you guys, have an opportunity to intervene and disrupt the cycle of intergenerational traumatic stress and substance use transmission. So here's some fine prints. This is really an introductory training on traumatic stress. I would recommend having some ongoing consultation. The other thing is that some of the material that I present might be upsetting to you. And I want you to take care of yourself. So if you need to take a break, if you distract yourself on your cell phone, that's totally fine. I'll understand. Okay, so the opioid epidemic has specific implications for parenting. So oftentimes parents who have substance use disorders really they're parental instincts are intact, and so they want to try to shield their children from their substance use. And unfortunately, sometimes what happens is they shield them, but the substance use kind of takes over, and so then there's a lot of neglect, and even physical neglect, emotional neglect. We also know that parents with opioid and other substance use disorders are often less emotionally available to their children, and they're less responsive to their children's needs. And so what you've got are kiddos who are learning that adults can't keep them safe and adults can't help meet their needs. A lot of times adults or parents with opioid use disorders also have their own trauma histories. And one consequence of traumatic stress is having an underdeveloped ability for reflective skills. And so what that means is you've got parents who have a hard time taking their child's perspective. And so it's hard for them to have empathy for their children's experiences. So what do we know about the opioid epidemic in foster care in Ohio? So in about 29% of all children taken into protective custody have a parent who was using opioids at the time of removal. So it's pretty high in Ohio. And 70% of children in custody in Ohio are under the age of 1. So we're talking about young children whose parents who are suffering from opioid use disorders. So I kind of alluded to the neglect piece, but there's all kinds of traumatic events that can happen in the course of the opioid epidemic. So some kids are seeing their parents using substances, and that's a traumatic experience. In utero exposure, so the case that Steph presented is a great example of what in utero exposure can lead to traumatic experiences for the child. We see a lot of stress responses. Unfortunately, some kids are losing their parents to opioid overdose deaths. And sometimes parents are putting their kids in the care of other unsafe adults who then might be more likely to physically abuse them or sexually abuse them. And then sometimes they're taking their children with them into unsafe neighborhoods or unsafe environments, and they're witnessing community violence or domestic violence. So lots and lots and lots of traumatic experiences. So let's talk a little bit about the trauma response. So this is just a recap because we heard this in the first week, but exposure to traumatic events impacts our entire body system. So starting in the brain, and it's like an automatic response to keep you safe in the moment. And so then it creates one of 3 responses. You either freeze, you flee or try to run away, or you fight. And our brains, not to get too technical, but our brains reinforce us for however we respond, so that we're more likely to, the next time our brain senses a danger, we're gonna do whatever it is that we did the first time. So if you froze the first time, your brain's like, awesome, you're keeping you did it, we're safe, I want you to keep doing that. So the next time your trauma alarm system goes off, you're gonna freeze. Same thing with flee, same thing with fight. And this is normal, it's adaptive, it keeps us safe. Unfortunately, with traumatic stress, then we've got an overactive alarm system, and it's going off when you're not really in danger. But if you think about every time you perceive that you're in danger and your alarm system's going off, then you're freezing, fleeing, or fighting. That has lots of implications for learning, for development, for building relationships with people. Okay. So I do want to spend a little bit of time talking about how memories are stored. So memories for traumatic events are stored the same way as all of our memories are. So we store memories in all of our senses. So it can be in sounds that you hear, in the place itself, in a certain sensation or touch that you feel. It could be smells, it could be people themselves, whatever you see in your environment, and then also in how you feel. And so all of these all of our senses then serve as trauma reminders for us. And so, you know, if you were sexually assaulted and the person who sexually assaulted you was wearing a red sweatshirt, and now every time you see the color red, you're having a trauma response. If you think about how often in your day you might encounter the color red, sometimes that's a lot. And that's true for these kiddos. And so what this ends up looking like is you've got kiddos who are, you know, freezing or fleeing or fighting, and it doesn't always make sense for the situation, and it's kind of hard to figure out why they're doing that, and they don't know, and a lot of times the adults caring for them don't know, and so it gets really confusing. So let's talk about some tools and strategies that help these kiddos. So the ARC framework, this is Attachment Regulation and Competency Framework for Complex Trauma. Really, there's 3 different layers. At the base, you've got the attachment blocks. So attachment is really seen as the main building block. If your attachment bonds aren't intact, then it's going to be hard for you to learn regulation skills, and it's also going to be difficult for you to then learn competency. I'm going to spend a lot of time talking about the attachment blocks, because with young children, that's what we're really building. Not that the other things aren't important, but we want to make sure that our families have a strong attachment. And so I'm going to mostly focus on adult emotion management and attunement. Okay, so I love this picture because I feel like this is the epitome of what it's like to grow up as a child with traumatic stress. You kind of got it, all the pieces aren't there, but they're still growing. So you've got this tall tree on the side of this mountain, and it doesn't look like a very nurturing environment that it had, but it still grew up. And so if you think about that's what life is like for these kiddos. What we want to try to do is provide some of that foundation. And, you know, we adults are not, like, we have our own responses happening. So I talked about a lot of parents having their own traumatic event histories, and things that their children do can sometimes trigger what's happened to them. And a lot of times parents will parent based on their own traumatic response as opposed to what their child needs. And so, you know, what you want to do is help parents figure out the specific challenges, and even in your own practice, knowing that you're bringing in things too from your own life, that's going to impact how you work with a family and the specific child. So that's where the idea of parallel process comes in. So I've got this example. So you've got this little girl, and she's thinking to herself, you know, I'm bad, I'm unlovable, I'm damaged, I can't trust anyone, and you know. And then you've got her mom who's saying, you know, I'm an ineffective parent, my child is rejecting me, the things that I'm doing aren't working. And they're kind of looking at this caregiver or this provider who's also having some thoughts about not being good at their job, feeling like, like this family just needs to get together. And then, starting some of that burnout stuff with, like, I need a vacation, I need to tap out. As I read this, I want you to think about it, if you've ever encountered something like this, where you've worked with a family and it's like, everything, you've tried everything, you don't, everything, it's not working. And families the parents are frustrated, the child is not doing well. And everybody's kind of stuck, and they're in their own little bubble, and it's kind of hard to then get people to be on the same level, the same unit. And so with parallel process, it's this idea of being able to take the perspective. So as the caregiver, as the provider, if you're a speech language pathologist and you've got this family that's really challenging, they're not listening to the strategies that you're giving them, or they've tried them and they're not working, and you're feeling frustrated, it's the idea of being able to take the perspective of that parent, and then helping the parent learn how to take that perspective of their child. And that is how we start to build some emotion management in the adults. So this starts with self-monitoring skills. So being aware of your own thoughts and feelings, your own responses, and then practicing some relaxation skills, whether that's deep breathing, whether it's yoga or meditation or running, whatever it is that you're doing to help you be able to relax, to come into the situations at a different space. Sometimes it's using distraction strategies. So like I said at the beginning, if something is upsetting to you, take 5 and play a distracting game on your phone, or count all the blue objects in the room, things like that. It could be a self-soothing thing. So maybe you carry a small rock in your pocket throughout your day that you can feel when you start to notice that you're getting overwhelmed. So I worked with a therapist, and I thought his strategy was brilliant. It was a very busy therapy practice, back to back to back families. And what he would do is every time he would go to get somebody from a new family from the waiting room, he would intentionally walk slowly to the waiting room and think about, okay, let me do some deep breathing as I get there, kind of checking in with himself in that 5 minutes, which is sometimes hard to do in our busy lives and practice. The other thing, so one strategy to help with families is to intentionally build a caregiver support system with the families that you're working with. So I'm thinking about my nurse navigator friends who are working with moms and dads who, maybe aren't really sure who their resources are. So I thought I would take some time now and have us practice this. So thinking about for yourself, who do you go to when you're feeling stressed? And if you want to write these things down, this might be helpful, but you can also just think about it. Who do you go to when your car breaks down? Who do you talk to? Who do you want to tell when something great happens to you? Or something, something great happens to your children. Who do you want to tell? It could be, posting it on Facebook. It could be talking to your parents or your siblings. It could be, like if something breaks down at my house, like calling a mechanic. If something's going wrong at work, I might want to talk to a coworker. as you're thinking about it, were you only talking to one person? Or were there lots of different people who you rely on for social support? I'm hoping that there's a lot of people that you're talking to, and different people provide different kinds of supports to you. So I'm not going to talk to my auto mechanic about my rough day at work, but maybe sometimes I might if I feel like I've got a good relationship with that person. And so this is something, an exercise you can do with the families that you're working with to intentionally build a network of social supports, and kind of helping parents understand that they aren't alone, and there's maybe lots of people that they encounter in their day-to-day that provide a sense of support, and sometimes we just need to strengthen those relationships. Okay. So once we've kind of got caregivers who can be regulated, and caregiver is a broad term, so this could be you as a provider, this could be a parent. Once we've kind of got ourselves in check, now let's talk about attunement. So the idea of attunement is being able to accurately read other people's cues and respond appropriately. This really requires a lot of skill building. So you have to be aware of other people's body language, their thoughts, which you might be like, how do I know other people's thoughts? I can't hear them. And then, their emotions and their behaviors, and kind of taking into consideration all of these things to help inform how you respond to them. The goal of attunement is to respond to the emotion underlying the behavior and not to react to the most problematic behavior. Now, I'm going to say that again. We're looking for the underlying emotion that children are having when they're having these temper tantrums, when they're having big meltdowns, because that is where we're the biggest bang for our buck when it comes to traumatic stress. A lot of times kiddos look aggressive, or they're oppositional, or they're doing things that are just very extreme for the situation, and we're paying attention to that behavior, but we're missing the fact that they're really scared. They don't feel safe. And addressing that behavior in our typical, okay, provide a consequence to that behavior, that's not going to work with these kiddos with trauma. It's not that it doesn't work, it's just not going to be as effective as if we focus on that underlying emotion and we're addressing that. And so, in fact, I work with lots of families who are giving lots of positive reinforcement throughout their day, and their kids are still having these meltdowns and they're still struggling. And parents are like, well, we're trying everything. We've done timeouts, we've done, time ins, and nothing seems to be working. And so then I start to talk about, okay, well, what do you see? What is your child doing? What is that doing for you when they start to have these reactions? So really needing to break it down for families and for ourselves, because this stuff is tricky. And so with that, I want us to be able to practice. And so I have this video, it's the removed video. So if you've seen it, awesome. If you haven't, it's a video about this little girl named Zoe and her little brother. And it walks you through her traumatic event history, and then kind of what's happened to her and her journey in foster care. And so what I want us to do is watch this video, and then I want you to pay attention to what traumatic events does she experience, and then what were some of her trauma reminders, and what was her response.
someone hurts you so bad,
I don't think you understand.
it stops hurting at all. Until something makes you feel again. And then it all comes back. Every word. Every hurt. Every moment. How could you ever understand where I come from? Even if you ask, even if you listen, you do not really hear or see or feel. You don't remember my story. You haven't walked my path. You haven't seen what I've seen. My past defines me. This is who I am. I am unseen, unheard, unwanted. That is what I am, if even I am anything. It seemed like the same thing that held me up forced me down. And the world turned upside down, and order disappeared. Nothing was how it was supposed to be. And a heavy sadness filled my soul. Deeper and deeper I fell within myself. And nothing could draw me out. Trapped in the misery of my life. Lost in the sorrow of my soul. Unable to see the light. able to see the dawn, to feel, to hope,
What are you doing picking my fruit?
to dream. And I found the darkest days of my life kept coming. The blackest nights for my soul never stopped. It seemed like it was always nighttime and nightmares, and never morning. And maybe you wonder why, but mostly you try not to think about it, and try to get by, and try to survive. And all the other stuff seems so much like nothing, compared to just wanting the most important things back.
So there's more to this video. If you're curious about it, you can Google it on YouTube. But now I'd like us to talk about, okay, so what were her traumatic events? You can shout them out, you can put them in the chat.
Domestic violence.
Violence, yes. I'm seeing being physically abused, neglect, drinking, removal from her brother, that's a good one. Her whole life seems like a traumatic event. Being taken away from home, yep. Mother verbally abused, she was physically abused, separated from her brother, good. Multiple foster placements, very good. Yeah, so lots and lots of traumatic experiences. Parentification of a brother, being embarrassed, absolutely. What were some of her trauma reminders? What do you think? Yelling, loud noises, good, yeah. Being grabbed when she went to the new home, yep. Loud sounds, definitely. Being physically restrained, yes. Family visits, Sirens, the police, the toy and the supervised visit. Husband and wife in foster care, the dress, the siren, yeah, good. Not knowing what's next, absolutely. And how did she behave? What was her response? Press, withdraw. Yeah, carrying her things in a garbage bag. That's pretty, unfortunately, that's a common issue that kids in foster care are faced with. The garbage bag. She fled, she ran, she's combative or withdrawn. Food insecurity, rushing for food on the tree, yep. Crying, yelling. Yeah, good. And then let's talk about what might be some of her feelings behind her behaviors. Yeah. Anxiety, fear, feeling hurt, disappointment, being terrified, unloved, unwanted, feeling a lack of control. No one knows what I've been through, feeling worthless, feeling invisible, alone, any would have hope. Yeah. So for Zoe and like many of our kids who've had traumatic experiences, she is in this perpetual state of survival right now. And it is then challenging for her to engage in school and to learn new skills, like life skills. And so that's something, I guess, bringing awareness to this idea that these kiddos are not doing poorly in school because they're choosing to, or they're not choosing to have temper tantrums. So the incident with the throwing the record player over the cliff, that was maybe not the best decision. So she's exploring her environment, seeing what would happen, kind of testing boundaries maybe. And that unfortunately led to more, I would say, traumatic events. Good. Nice job practicing your attunement skills. Okay. And I know I'm getting close to being out of time, I think, so I'm mindful. So I guess the last thing I will talk to you about is teaching attunement skills. So other ways you can do this with families is to teach feeling charades or follow the leader type games like red light, green light, Mother May I. These are all kinds of strategies that young kids in particular really grasp onto. Body percussion, so practicing patterns, like I'm going to make a pattern and then you're going to follow my lead, and then you're going to make a pattern and I'm going to follow my lead, or I'm going to follow your lead. These are great ways to practice attunement because you have to really pay attention to what the person's doing. And yeah. Okay. So I will end there.
Thank you, Dr. Roley-Roberts. What a great presentation. That video, I think I was just so engrossed in it, and I've seen other people just watching everyone's faces as they watch the video, and so many helpful ideas just on how to approach trauma, as well as some take-home points for us. So thank you so much. We, as a lot of times what happens with us, we have a few minutes for questions and then we'll wrap up. So I see some questions in the first question in the chat from Aaliyah, who's wondering, when is the best time to practice attunement?
So practicing picking up or learning how to attune would be when a kiddo is regulated, maybe. Just getting some skill practice in, but really where it's going to count is when the kids are having dysregulation. So when they're having temper tantrums, when they're you know, behaving defiantly, or whatever the issue is. Does that help answer?
Thank you yet again, Dr. Roley-Roberts.
Have a great weekend, everyone.